Hello, I'm Dr. William Rossy, an orthopedic surgeon and member of the medical staff of Penn Medicine, Princeton Health. I'm fellowship trained in cartilage restoration and sports medicine. Today, I'm going to talk about cartilage restoration and how minimally invasive procedures can restore joint function and prevent future arthritis. Cartilage is the flexible connective tissue between your joints. It can become damaged from overuse in sports such as running and tennis, or from a sport-specific injury such as a kneecap dislocation or an anterior cruciate ligament tear, also known as an ACL tear. Poor alignment of the joint and excessive weight can also cause cartilage to wear away. For some, cartilage degenerates slowly over time, eventually leading to osteoarthritis. In the past, damage to a joint's cartilage meant that at some point in the future you could develop arthritis, and this could lead to severe pain that might ultimately require a joint replacement to restore function. Now, there are cartilage restoration techniques, which are often minimally invasive outpatient surgical procedures that can help you avoid these concerns. These procedures are used mostly on knees and sometimes on ankles, and are designed to restore as much natural function as possible to these joints. Increased swelling and pain are signs that something is happening in the joint. If you experience these symptoms, the next step is to undergo an MRI, an imaging test that will help your doctor make a clear diagnosis. If you do have cartilage damage, a restoration procedure is often performed as soon as the damage is detected. This will help reduce the chance that you will develop arthritis in the future and potentially avoid the need for a joint replacement. To be considered a candidate for cartilage restoration, the remainder of the joint must be healthy. This includes being free of any signs of arthritis. For this reason, outpatient procedures are especially effective for patients under the age of 50 who are physically active. The goal of the procedure is to help the younger patient avoid a future joint replacement. For older patients with a similar diagnosis, joint replacement is generally a more effective treatment. Options for restoration surgery can include the use of a patient's own cartilage cells to promote healing and cartilage regrowth, or if the damaged area is very large, cartilage tissue can be used from an organ donor and transplanted into the damaged area. When a patient's own cartilage cells are going to be used, we first evaluate the structure and size of the damaged joint area with a standard knee arthroscopy procedure. We then take a biopsy of the healthy cartilage from a non-weight-bearing area of the joint and grow these cartilage cells in the lab to increase the number of cells that can be used. Several weeks later, once the patient's cartilage cells have reached an appropriate number, we can then move forward with the second part of the procedure, placing those healthy cells back into the damaged area of the knee. When donor cartilage is used, precisely measured pieces of bone and cartilage are transplanted from a donor into the damaged area of the patient's joint, replacing it with normal bone and cartilage. This technique only requires one surgery and is typically done through a minimally invasive incision. During recovery, patients use crutches to reduce pressure on healing cartilage. Most patients can resume their normal level of activity within 6 weeks, with a return to sports in anywhere from 4 to 9 months. Recovery largely depends on whether the cartilage used came from the patient or from a donor and involves a period of non-weight-bearing restriction and physical therapy. There is a strict rehabilitation process, but following the recommended courses of treatment results in a very high success rate for patients.